I would like to say thank you again to the AAMC for sponsoring the conference. I would next like to introduce Dr. Ronald Chapman, our third keynote speaker. Dr. Chapman has a medical degree from the University of Southern California and a master's in public health from the University of Michigan. He is a board-certified family physician who has dedicated his career to public health and medicine, caring for the uninsured and underinsured in California. Dr. Chapman was the Chief Medical Officer of Partnership Health Plan of California, a managed care Medi-Cal plan serving Yolo, Solano, Napa, and Sonoma counties. For 6 years prior to that, he was the Public Health Officer and Deputy Director of Public Health in Solano County, California. From 1998 to 2004, he worked at the California Department of Health Services as the founding chief of the Medicine and Public Health section. Please help me welcome Dr. Chapman.
Good morning. How many people here were saw the prior speaker who was dancing? I do not dance. And I don't have any PowerPoint slides, but I am going to talk about the periodic chart of elements. We're going to talk about carbon, nitrogen. No, not relevant to what I'm going to talk about. So I have, I think, 25 minutes, probably now 23 minutes. This is, I think, the third time I've come to speak. I do a lot of speaking with students who are trying to figure out their careers. We have a lot of interns at the California Department of Public Health. So I'm the director and state health officer. Lots of students rotating through our department in a variety of areas. I am here this morning for all of you. So I've already chatted with a couple of you and kind of figure out what some of your questions and thoughts and issues are. But I really want this to be a dialogue. I want you to feel free to ask questions. And so one of the questions that I've already heard from Charles is, I'm the third speaker in a row here with an MD. Do you have to be a doctor to do public health? Absolutely not. So I started my career first with a master's in public health. I did not go to med school first. And I worked as a community health educator. I worked in the migrant fields with migrant farm workers doing community health education and public health prevention work. And it had been a long-time dream of mine to be a doctor and to care for people one-on-one in a clinic, in a hospital. I really, really loved science, still love science. Some people call me a nerd. I did have chemistry wallpaper in my bedroom in high school, I'll admit that. I have a t-shirt with the periodic chart of elements that I wear at home, but anyway, not in public. So I have balanced both public health and medicine throughout my entire career. I spent 20 years caring for the poor and uninsured in California, but I never was in clinic more than 2 or 3 days a week because the other half of the time I was doing public health. Academics, research, teaching, combination. I have not seen a patient in the last 5 years. I am now pure public health, and my career has slowly evolved that way. There are loads of opportunities in public health. You have chosen a profession, that being health, which has a fantastic mission. It's all about caring for people and communities. You're at the point now of starting to think about careers, right? What kind of jobs am I going to get? In public health, there are loads of jobs. I listened to the prior two speakers. In my department, we have 3,600 employees. In the last year, we hired 900 new staff in just a variety of job categories. Plenty of jobs. That's just the state health department. And then every county in the state has their own public health department, and they're hiring, and that's just government. You saw the list of other opportunities. Is it Alice? Mentioned public health labs. Really exciting opportunities in public health laboratories. We have one of the premier public health laboratories in the United States in Richmond. Our California Public Health Laboratory, we have about 800 staff on our, I think it's a 15-acre Richmond campus. And we're doing absolutely cutting-edge science, testing, research. We support and back up the CDC We do testing for most of the western United States. And then pretty much all of the public health departments at the county level have public health labs. I was director of public health in Solano for 6 years, and I supervised the public health lab that we had there with outstanding lab scientists doing testing every day regarding outbreaks, foodborne infections, on and on. And the testing that we do in public health is very unique. Hospitals and private labs do not do that type of testing. We have a special niche just in public health. So I have some stories I can share, examples about public health and job opportunities, but I said I want this to be a dialogue. So are there any questions right now? Charles.
I had a question. I know the UC's gone through budget cuts as a result of the state budget. Are your labs and your program paid off the state budget and you had to cut back because of that?
So cutbacks in public health. I have a $3 billion budget. That's with the B. Lots of zeros at the end. And 3% of that budget is from state money. So the vast majority of funds actually comes from the federal government, from NIH, from CDC, and other federal agencies. And those monies go up and down over time. During the recession, we were hit hard. And during the recession, there was about a 15-month period where we in government public health at the state level had a hiring freeze and furloughs. So during tough economic times, it's tough for government across the board. But since that time, which was a couple years ago, we've been hiring like crazy and our budget is okay. But again, it's variable, it goes up and down. Yeah, hi.
What are the major focuses of the health department right now?
Major focuses of the state health department right now. Who can guess and tell you it starts with an E? Ebola. Yeah, so Ebola is a major focus right now. We have activated our emergency operations center for the department. I'm having regular briefings and calls with the governor's office. I've had calls with the governor's office the 3 past nights in a row. And my phone's sitting right there because I'm expecting the governor to call me this weekend to chat about Ebola. When I have my executive top emergency team with me during briefings about Ebola, I can go around the table and tell you each of their jobs and responsibilities. So for example, I have on my left my public affairs people. These are people who are doing health education, media, social marketing. They're experts in communication. I've got my emergency preparedness team. These are public health folks that are all about capacity, readiness, and response to disasters and emergencies, everything from Ebola to, believe it or not, drought, to earthquakes and on, fires. They all have public health implications. Going around the table, I have my Center for Infectious Disease. I have some of the top infectious disease experts in the world on my team. These folks are laboratory scientists, they're physicians, they're community outreach workers, they're a variety of public health workers whose expertise is focused on something like Ebola, out in the community to identify patients early, to isolate and quarantine people if need be, to do contact tracings, door to door. And we work very closely with our local health departments and the hospitals and the EMS systems, the ambulances. We're all part of a huge system. Next week, I have a call with the entire system. I'm calling an all-state preparedness call for Ebola. And the last time we did this call was 2 weeks ago. There were 1,100 people on the call. I'm expecting probably upwards of 2,000 on this call. So going around the table, I have my administrative team. I've got folks that are involved with budgets and finance and contracting and accounting, and those people are critical on our emergency operations team. If we don't have our administrative work flowing properly, it mucks up our entire response. I have nursing staff, it just goes on and on. So I didn't mention epidemiologists. How many folks know what an epidemiologist does? You're a smart group. Okay, forget that. So I have epidemiologists on my team too, and I could go on, but that just gives one example. Ebola is a hot topic. E-cigarettes, another really hot topic. We are concerned that e-cigarettes are going to completely undermine the work that we've done for the last 20 years to fight tobacco in California. We have the second lowest rate in the country, second only to Utah. Our rate, you heard Chicago was about, I think he said 16, 17%. Ours in California is about 11. We've been doing a great job. Very concerned that e-cigarettes could completely reverse that work. So we have a tobacco program with nearly all of the specialists that I just mentioned that are working to figure out policies around e-cigarettes, just as some examples. Other questions? Yeah. Opportunities to work directly with patients without an MD. Yes. So I'm going to have to kind of interpret your question a little bit, because when you say patients, that kind of means a certain type of person. I mean, I like to think of it as working with people, so let's broaden it a little bit. So for example, in Solano County, we have WIC clinics. We have 5 WIC clinics. How many people are familiar with WIC? Women, Infants, Children's Program. It's supplemental foods, nutrition education, breastfeeding education for women, infants, and children. It's all provided at the local level. The state organizes and runs the program, run through local health departments and other agencies at the local level. In those WIC clinics, we have health educators, we have nutritionists, we have loads of staff who are working directly with moms from very poor, underserved communities. Just to give you a little sense of the people of California and the need for public health, 50% of women, infants, and children in California will at some point in their lives be on WIC. Half. So a lot of need, a lot of poverty. WIC clinics are an example. We have public health nurses. I had 30 public health nurses in my department in Solano. They were out in communities all over. There've been newspaper articles. Some people refer to them as the angels of public health, because they're out in the neighborhoods, feet on the ground, in apartments, community. I used to tag along for some of these visits, and their primary focus is around maternal, child, adolescent health. So they're out there visiting high-risk moms, high-risk babies who are referred to them from the healthcare system. Baby's born, hospital says, whoa, this baby's got some problems, they need some help. They call the local health department, public health nurses go out. I think in Solano we did about 6,000 to 7,000 visits a year to high-risk moms and babies. Those public health nurses work closely with health educators and others that are also having contact and working with these folks. So that's just a couple of examples. I think there was a question over here. Yeah.
Back to the degrees, what is the general degree level, like within your department? Master's in public health, dual degrees, or which is more preferred?
So the general degrees in our department and which is most preferred. So I said we have 3,600 staff, and probably, I would guess, 30 are MDs. Not many. Lots of MPH folks, a lot. We have probably the largest single classification, job classification, is called an AGPA, Associate Governmental Program Analyst. We probably have about 400 AGPAs, and the vast majority of them are bachelors. It's that and staff services analysts and SSA are kind of the entry level into the department. And they do a variety of functions from helping research and set policy to managing contracts and budgets. It depends upon their background and expertise and interest. So we have another popular classification is called research scientist. We have a whole research scientist series, RS 1, 2, 3, and 4. And again, doing a variety of functions, everything from epidemiology to public health laboratory. And as a side note, and I've got like 9 minutes, to get a government job, especially at the state, you have to be on a state list. You cannot be hired if you're not on the list. To get on the list, you have to go to the state's HR website, look for these job classifications, and complete an application, and you get a score. You have to score higher than 70 to actually be on the list. And then when we have a job opening, the first thing we do, by law, is we go to the list, and we start working our way through the list, asking people if they're interested in interviewing or not. So let's just give you insight. Other questions, thoughts, comments? Yep, Charles?
Do you have a lot of employees who are working there with a bachelor's degree and leave and go get their MPH and then come back to the health department?
Absolutely. That's really common. And in fact, most of them do it while they're working. So they'll do an on-the-job training through UC Davis, UC Berkeley, online, something along those lines. And we actually we pay half the tuition to state. Yeah, that's very, very common. One of the many benefits of working for the state. I feel like I'm recruiting for the state. You're going to have to speak up way back there. Go ahead.
Okay, so there are a lot of combined MD/MPH programs, both in state and out of state. Do you think there are any like negatives to say a program that can combine both major or both degrees in 4 years, or do you think that those are equitable in the benefits that you receive?
So, yeah, the question is about combined MD, MPH programs?
Yeah,
And other?
MD/MPH.
Yeah, MD, MPH programs, and whether there's a benefit to doing that as a combined program, and pluses and minuses, basically. Is that? So, I took a non-traditional route, right? I got my MPH first, which means that I went to a 2-year graduate program. As a medical student getting an MPH, you go to 1 year. Most medical students pick epidemiology. And I think that's because of the bias of those dual programs. My master's is in health behavior and health education. When you look at a school of public health, there's generally, 11, a dozen different departments, everything from biostats to global health to hospital administration to health behavior, population, on and on. I think that in a dual program, you may be limited to what you can actually concentrate or specialize in. And again, most commonly, it's epidemiology. I think, you have a comment? Yeah.
Just, you're right on that. It was great. All these questions are great. And I'll be doing a section on dual degrees, not just medicine, but others with public health. It really varies. So you're right, traditionally that has been, but I think that's opened up a lot more to behavioral sciences, environmental health sciences, program planning and evaluation, a variety of things. So, but that's where you shop around, you find out, you go on webinars, information sessions, etc.
I do have a bias. I do run into a lot of MDs with MPH who are not using their MPH. They're trained as physicians. Now, by the time I did 2 years master's, I did 4 years of med school, I did 3 years of residency. By the time I was out, I was 30. I had my first child 1 week after I finished residency. That's when I started my life. It's a long road. It's a long road, a long haul. I loved every minute of it, but it was really hard work, and a lot of people don't want to put their lives on hold like that. while I was training and got out at 30, all my friends from college, they were already having jobs, making money, getting cars, doing whatever. That wasn't for me, but it's a major decision to pick the physician route, and you will be trained for 7 years to be a clinician, to see sick people one-on-one in the clinic and the hospital. So you have to be dedicated and committed to taking that route. Other questions? I think I have like 3 minutes. Go ahead.
The State Health Department, are you going to be working on efforts to expand the safe, secure, sustainable food for, the underserved areas? Assembly bill making the task force, which is going to allow, but it's limited, and there's a lot of push from the local places to want to expand that into the retail stores, but because that's wholesale and under the regulation of CDPH, there's a stop to it. And so I'm wondering if
So
CDPH is going to be making some efforts to.
the answer is yes. The answer is yes. And I wish I had more time to go into details. There's a lot of effort on this. We not only have our WIC program, we have our Supplemental Nutrition Assistance Program, Education, SNAP Ed, which is about a $100 million funded program. And we have our Health and All Policies Task Force, which just last year created a Farm to Fork office at the Department of Food and Ag, and that was a partnership with Public Health. There's a lot of activity going on in this area. Charles, do you have another question?
I just have one last question. What kind of people do you have working in the public health labs? Are they primarily?
They're really nice people. Yes, what kind of people?
Are they
No.
like CLSs as well?
Yeah, so these folks they love virology, microbiology, bacteriology. They love science. They love that chart. And they are required in California by state law to have a public health microbiologist certification. That's part of their training. And then, we hire people straight out of the training from the public health microbiologist certification. But it's, again, there's just unbelievable lab. And, if anybody's interested in the lab work, you should contact your local health department or the state, and we're always giving people tours and showing folks around. I think I have 2 minutes. Sarah. This is our dentist in the, any other dental students or dentistry in public health is awesome. Oh, a DRPH or a PhD. Yeah, I would guess, and maybe you have a better sense of this, but a lot of those folks stay in academia and are doing really important research that supports the development of public health policies. Folks that have DRPHs and PhDs in public health that are actually out in the field, they play a variety of roles. A lot of them actually end up in significant leadership roles, running large programs, even being directors of public health at the local level. Not a requirement for those jobs, but I would say policy is a big part of their work. Other questions in the last minute? Yes, hi. Sure, open internships for labs. We're always looking for interns. So if you're interested in that, come talk to me. I can give you my card and get you set up with the folks that bring in all the interns. So I think I have, how's my time? I have 1 minute? $10:25. That's it. Time's up. Congratulations on your choice of a great profession, and I appreciate it. Thank you.